Good afternoon, ma.
Good afternoon.
So my name is Shamsuddin Sani, and I am from Gaskiya Online TV, and together we are with Dr. Salma Anas Kolo. So just the way I introduce myself, ma, please could you introduce yourself?
Thank you very much. I'm Dr. Salma Anas Kolo. I was the former national team leader, or you may call it country director of the Maternal, Newborn and Child Health Program in Nigeria, a program funded by DFID that is aimed at reducing maternal death. Yeah, so but I've just resigned that post about 2 months ago.
That is excellent. So ma, please could you tell me a little about your biography?
Okay. As you said, as I have said, I'm a medical doctor, a public health specialist, and I have an experience of working in public health for almost 20 years and above. I'm originally a civil servant, a director in the Federal Ministry of Health, but spent a lot of my time working with development partners. I've worked with the United Nations in Nigeria and also internationally, in the Middle East especially, and in some part of African countries, all aimed at saving the lives of people, especially women and children. So recently, not too far long, I was recognized by the Governor of Borno State, Governor Kassim Shattima, and was called to serve in Borno State as the Honorable Commissioner of Health for 4 years, from 2011 to 2015. And that was a big eye-opener for me because it has brought me very close to my people. I was able to come in contact with them in all the 27 local government areas of Borno State. And if you recall, it was the peak of the crisis. That was when we had attack by the insurgency, and it peaked at around 2013 to 2014 when I was the commissioner. But despite that, we were able to make a remarkable improvement in terms of rebuilding of hospitals, especially general hospitals. We equipped almost 22 general hospitals, and we embarked on strengthening and revitalization of the primary healthcare facilities, because most of our people live in rural communities in Borno. So we were able to revamp a lot of the primary healthcare facilities, and for the first time also were able to provide free maternal, newborn and child health services within that period. We also was able to curb and control polio transmission in Borno State during that time. If you remember, we even got the award from Bill Gates as the best performing state in terms of efforts to interrupt polio before the currently resurgence of polio in Borno State. So a lot of remarkable achievements were done. If you also look at the area of human resources for health, we were able to step up recruitment of medical doctors from only 35 that we inherited in 2011 to over 100 medical doctors, with very good incentives and support by the state governor, Kassim Shattima. So it was quite remarkable, and we did a lot of capacity building of our people in Borno State. And for me, it was a big eye-opener, as I said. That is not enough. A lot still needs to be done. But I mean, that was a step in the right direction. So it has closely brought me, and that was when I also picked interest in education. Because I felt that one of the major determining factors that led us to where we have the insurgency in Borno actually has to do with education and unemployment of young people. So from there, I started identifying young people within our communities and then supporting them with little stipend, which I call the scholarship, to support them to continue with their higher education, especially in tertiary institutions. I also identify especially young girls and started supporting them to get education. So, but still a lot needs to be done. So these are some of the few achievements. And then when I left in 2016, I came back to the Ministry of Health, Federal Ministry of Health, and also with the support of the Honorable Minister of Health and the former Permanent Secretary, Linus Awite. We shared the same vision. So we're able to set up the Humanitarian Crisis Desk that improved the coordination of humanitarian crisis response in the country. So that was also an achievement, and it has come to stay, and this is what has been rolled out at the moment in the northeastern states, which is providing huge support for the people of the north in the health sector. So I worked briefly as a coordinator of that. Then I left, and then I followed my passion to save the lives of women and children. And then I was offered the position of to coordinate the national response on maternal, newborn and child health, which is mainly funded by DFID. It's one of the largest programs of health in Africa funded by DFID. And we made very remarkable achievements in trying to improve the health of women through provision of free commodities, life-saving drugs, strengthening the primary health care facilities, empowerment of communities, especially community leaders, religious leaders, because it's a joint responsibility. And it has really helped. And then we also made a lot of partnership with unions, especially of transport workers, to be able to help when it comes to transportation of women that have complications or are in need of help to access services within health facilities. So it's a huge, remarkable achievement we made.
Exactly.
Yes, and I wish I can have an opportunity to replicate all what has been done in some of the northern states, especially in Borno State, my home.
Wow, that is excellent, ma. So, ma, as a former commissioner of health in Borno, and someone that have worked nationally and internationally, what do you think are the major challenges facing people in Borno State?
Well, I think the major challenges, as I have said earlier, is the insecurity. That is number one. So we have to work towards ensuring that we redeem and have peace back to Borno State. But we have to look at the drivers of that, the drivers of insecurity. One of the major drivers of insecurity is education.
Exactly.
When we have our young people well educated, they become independent, they become self-reliant, and they take a decision on their own that will improve their future. So this is what is grossly lacking. So we have to focus on education. Education, and I continue to say education is number one priority. And we should not forget also the girl child, because it's the girl child that grows to become a mother. And she is a mother of her children, not just children, the community, and also the nation. And it's a common saying that when you educate a girl, you educate a woman, you educate a nation, because she's the first person that starts to inculcate lessons, teaching for her child, and that's trickled down to the whole community. So girl education is very important. We have to ensure that our schools are safe for the girls. And you know that Borno is one of the places that suffered for the first time in Nigeria the abduction of over 200 girls. And this happened again in Dapchi. So there is no reason for it to happen again. So we have to be very sincere. We have to step up our action and ensure that all our schools, not only girls' schools, are safe and secure, so that children will be free to learn and be comfortable to relax to have education. So this is mandatory. There is no two ways about it. We can't send our children back to school with just a barbed wire and just a shabby fence that anybody can jump in and threaten girls in school or even the boys in school. So this is unacceptable if we want to develop. So we have to fix our education in place. And then secondly, it's about employment. Employment, we recognize that once you are educated, you don't have to be employed in the formal sector. But what you get to know, most people are waiting with their certificates to be employed in government. Government cannot employ everybody. We have to learn to create jobs. Entrepreneurship is very important. Skills acquisition is very important for the young people. And then we give them the opportunity to create jobs. And I'm glad to say that most of our young people in Borno are very enterprising, are very educated. So they should not be used just by the political holders and then neglect building themselves. It's not about a leader coming after 3 years to just dash out money or buy vehicles and give to young people, and that is progress. That is not progress. Progress is about building human capacity. And for me, I always continue to advocate for that, and I'll continue to advocate for it, not only for government, but to the community people, to the followers themselves, to the young people. You have to be enlightened, you have to have skills, you have to learn to create a job, not for somebody to come and give you money, and then you think that is a leader and that is development. So we have to shun against all those practices if we want to develop. We are in the same country, we have 6 regions in this country. I'm sorry to say, Borno State is too backward, or in the Northeast in general, is too backward. I mean, we are very intelligent people, very enterprising people, but we just have to change the way we think, have a reorientation of ourselves. I mean, I'm sorry to say, look at what's happening in the Southwest. People develop their capacity and create jobs in terms of what they do. So, I mean, job creation is very important so that we have an empowered generation of young people, well-talented young people, that will use their own mind, that will use their own hands, their own brains to create jobs for their future generation. So I always say, let's secure our future. Exactly. Let's secure our future. I think we should be living better. We should be doing better than where we are today. I agree that the government have put in a lot of efforts, but then a lot needs to be done also to realize those efforts. Communities have to come in. Then the third, I will say, as a medical professional, I went into the medical profession to save lives. We've not reached anywhere in terms of saving lives. It's like we have just started it. There is a lot that needs to be done in the health sector development. We need to have a strengthened health sector, right from the primary health care level to the tertiary level. We need to have a huge human resources that will work in our facilities. Not only doctors, but also nurses and midwives are key to life saving. And it doesn't cost so much to educate a nurse or a midwife or a community health extension worker. So all this can be done. It can be done. It's not something that it's beyond us. It's not it's above our limit. It's something that once we have a genuine commitment, once we have the people in our heart, once we have the understanding even of the people themselves, the community people, the young people, the women themselves, the community leaders, the religious leaders, I think it is doable because others have done it.
Wow, that is excellent, ma'am. So, assuming people of Southern Borno will give you an opportunity today to come and serve them, what are those new things that you bring on board that are not there? And what are those things that you can bring, that you can continue with? Those, things that are good, that you feel like these things are, good to continue with?
Yes, I wish the people of Borno will realize and change the way they think. It's not that I'm saying nothing has been done. A lot have been done, especially by the current governor and his team, because I am part of his team. So a lot have been done to put, but government cannot do it alone. People have to rethink what is progress. Progress is not about me giving you money. Progress is about building capacity. And as I tell them, you can have 5 graduates in your house that are jobless, that have nothing to do. You can have everybody in your house that can fall sick one day. They cannot even access a health facility. So progress is about seeing progress in terms of development. The education sector, the health sector, the infrastructural development in that community. So I wish the people of Borno will have a change of orientation to ask themselves, why are we where we are? Why is, for instance, Lagos or Ogun State where they are today? Are they not human beings? What are they doing differently? There are lots of lessons we can learn. And doing differently is to change the political scenario. Let us select leaders based on merit. Let us select leaders based on track record. What have they done? Let us not select leaders that are corrupt. Select leaders with integrity. And this is very simple. We have very good people in Borno State that have track record, that are people on women and men of integrity, that have made achievements. So we should go beyond, but they may not have the money to come into politics because of the way politics is done. So what I am urging my people is that they should go beyond their individual interest. They should look for credible people, people that have no corruption record, people that have not triggered any insurgency or terrorism against anybody. These are the people that can bring change up to the grassroots level. So we'll continue to do awareness, and the majority of these people, I would say, is at all levels. With the leaders themselves, the community leaders themselves, the women leaders themselves, the religious leaders themselves, the young people themselves. But significantly, the young people will have to do a lot of work because it's all about the future of the young man. They have to secure their future, because at the rate we are going, we are totally destroying the future of our future. I don't think there is any catastrophe that we are going to see worse than what we have seen today in Borno State. It's the worst that we have seen. So if that does not change our mindset, I'm sorry to say that nothing is going to change our mindset, because this is the worst scenario we have ever seen. So it's not a hopeless case. I'm still hopeful and I'm still optimistic that our people will make the right decision, because time for change has almost come. Election will start in 2019. We have less than 1 year to make a decision of our life for the next another 4 years to see how much we have moved. We should build on the good things that have been done in the past 4 years and continue to do it better. So everybody have a right. So what I always say is obtain your PVC. Don't sit on the fence and continue to criticize. Nobody can do it better, but collectively when we put our hands, I think we can make a big difference in our lives. So this is what I continue to tell my people in Borno State. Let us be all part of it. Let us be part of the change. Because don't say that it's because I'm from this region in Borno, I cannot be others. I mean, people should be selected based on merit, based on what you can offer the people. And we all know the people that can do that. So for instance, in Southern Borno, people will say, no, you cannot contest for this. This is only allocated for you. You cannot. And then we don't realize that we are leaving a huge talented people that can have a lot of intention, good intentions, experience to bring to change the way things are done. And I think change is inevitable. Change must happen. Exactly. And I'm not the one saying that. And from the Muslim community where I come from, we are always encouraged to change the way we do things for better. So I leave it at that.
Okay, thank you very much, Bia. We are together with Dr. Salma Anas Kolo. Thank you very much, ma. You're highly welcome.
Thank you.
Yeah.